Tobacco-Free North Dakota is a key partner in tobacco control efforts in North Dakota. TFND has been our production partner with these ENDS summits. Addressing the epidemic of ENDS is in North Dakota, use in North Dakota, is part of TFND's work. Our program relies on TFND's efforts to help address the political, statewide community, and youth-focused issues related to ENDS in North Dakota. Heather joined the team at TFND in October 2016. She has over 16 years experience in the nonprofit industry, with most of that time spent in statewide organizations. Because of this, Heather has built relationships and coalitions all across North Dakota, and working with people and bringing groups together is her favorite aspect of this work. Personally, Heather has a husband and 2 boys and enjoys travel, time with family and friends, quilting, bowling, and reading a good book. Now, Heather is passionate about creating North Dakota's first tobacco-free generation by working to create policies and programs that prevent our youth from ever beginning tobacco's dangerous addiction. Welcome, Heather.
Thank you for inviting me here today, Neil and team. I really appreciate the opportunity to visit with everyone. Wow, what a fantastic lineup of speakers that we've been privy to the last couple of days. They are some tough acts to follow, in my opinion. And so I'm very hopeful that I can add some value here, tying it all together at the end and just talking a little bit about our policy efforts. I'll just confirm that everyone is seeing my shared screen, since we had some issue with that for the previous speaker.
Okay. Looks here at good here at Mission Control.
Excellent. Okay, so for those unaware of who we are and what we do, we are Tobacco-Free North Dakota. I'm their executive director, and I've been doing this job for about 5 years. And we are a statewide organization that is a nonprofit. I answer to a board of directors located across the state, and we provide kind of variety of services to our coalition members, to our partners and organizational members, and to the public at large. We focus our work in advocacy and education, and in building grassroots support and coalitions across the state that would help us spread the message of tobacco prevention. Our mission at the end of the day is to improve and protect the public health of all North Dakotans by reducing the serious health and economic consequences of tobacco use. This is still our state's #1 cause of preventable disease and death. And I think Kelly earlier today did such a good job of highlighting just how detrimental that is. And then we also perform some lobbying functions, whereas the Public Health Law Center isn't able to do that piece of the puzzle. We are. And so we do work hand in hand with policymakers at local and state levels, in particular the state level with our legislative sessions every biennium. And so we'll talk a little bit more about that in depth in just a moment here. But before I get into kind of the down and dirty of the legislative session and past efforts and what's coming up, I think it's important to note exactly where we stand statistic-wise. And so these are the current North Dakota specific tobacco stats. And as I said, it's our leading preventable cause of disease and death in our state. I don't want to use the word interesting, it's tragic to note really that tobacco use is attributed to killing more people than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides combined. In North Dakota, that translates into around 1,000 of our citizens dying every year from tobacco-related diseases. A couple of years ago, in fact, we just had the 3rd anniversary of it. One of those 1,000 people was my dad. And so this work is pretty personal to me, and it really hits home to me. As Kelly said earlier, too, I'm going to reference back to her one more time. We wear the white hats. We really do try and do good work for the betterment of all of our citizens and constituents. And so in North Dakota, we have some good numbers and some concerning numbers. 8.3% of our young people in North Dakota smoke. That is way down from where it used to be at the end of the 1990s when the Master Settlement Agreement was occurring. And so that's excellent work that has been done over many decades. However, and you've seen today from both of our speakers showing different statistics and slides, much of that work is now being undone, and it's being undone at a rapid rate just in the past several years. 33.1% of our youth now report vaping or using electronic nicotine products. And that is from our YRBS survey of high school students. And so all of that good work, getting kids to equate tobacco and cigarettes as a bad thing, is being undone due to the murky nature of the e-products seeming to be safer, using all those familiar flavors and packaging to reference products that kids are familiar with or that they know and love. And so they're more apt to try those products. And then, as you have seen the last couple of days too, that nicotine is so addictive that it becomes really ingrained into their body chemistry really fast. And so North Dakota spends $326 million annually in health-related expenses caused by tobacco use. We also spend another $250 million, another $230 million or so in lost productivity due to tobacco use. And so that's about $500 million every year that our state is incurring directly as expenses because of this. And I think it's important to note that there are, in addition to all the other really great reasons we've heard over the last couple of days, but there are some really strong, clear reasons to treat tobacco products differently than other consumer products. There really is no other product on the market that when you use it, just how the label tells you to use it, causes so much destruction. And so I think it's important that we keep up the work that we do in the policy arena to try and mitigate as much as we can. So we know that some of the best policy for tobacco prevention and cessation is the three-legged stool to prevent tobacco use. That's having a fully funded comprehensive tobacco prevention program, having a very strong indoor smoke-free air law, and having high tobacco taxes. Of those three legs, North Dakota has one really good leg. That's our very strong indoor smoke-free air law, and I'll talk a little bit more about that in a moment, and its defense. And then we have two legs that are not as strong or not as good. One leg is our prevention program funding, cessation and prevention program funding. We have a very strong quit line. We have great work being done across the state through our local public health units, our healthcare systems, our behavioral health systems, and independent nonprofits like us. And they all are funded through some grant work through the Department of Health and the CDC, and that all coincides with our state plan for tobacco prevention and control. And so we are doing okay with that leg. It's not considered fully funded, but we do rank, I believe it's number 5 or 6 in the nation in terms of funding going towards that vital work. Where we kind of fail ourselves is the high tobacco taxes. North Dakota currently ranks 49th in the nation for tobacco taxes. We are only at 44 cents per pack. Our weight-based and wholesale-based rates for other tobacco products are also quite low. It's 60 cents per ounce for loose tobacco and 28% of wholesale for like cigars and cigarillos, and then the cigarettes are the 44 cents. The electronic products that we've been talking about all this time aren't taxed as tobacco products at all. They're at 0 because they're technically not classified tobacco in North Dakota, which has been very problematic for some of our policy efforts. Other policies that we support and talk are more considered promising practice, and that's where the Tobacco 21 comes into play. That was recently achieved, which is a pat on the back that we can have. Tobacco-free schools, grounds, parks, events, flavors fall into this category, labeling fall into this category, internet regulations also fall into this category of all promising practices that we support and promote, but don't consider evidence-based best practice policies the way we do the three-legged stool. So last legislative session, we monitored 9 tobacco-related bills. One of the main ones that I want to talk about today, because I feel like it's going to be vitally important for us to keep a pulse on this, is it was House Bill 1152. We dubbed it the cigar bar bill. It attacked our really strong indoor smoke-free air law by allowing for cigar bars and lounges to be reestablished in North Dakota when our bill or our law as it currently stands was passed in 2012. It was done as an initiated measure, meaning our citizenry voted to put that law into place through the ballot. And after something has been passed by ballot measure or initiated measure, it can't be changed for 7 years unless 2/3 of both chambers vote to change it. And it actually did come up as a bill in the 2019 session, but that 7 years hadn't sunset yet. And so they needed a 2/3 majority to pass that cigar bar bill at that time. Well, they didn't have it. And so the vote count on that might even be a little bit skewed, because once people knew that they didn't have the 2/3, they were able to vote in such a way as not to maybe tip their hand, so to speak. For the 2021 legislative session, the 7 years had passed. And so this was their true first attempt at getting a bill like this through with just a simple majority. And it was close. If you look through the records kept on nd.gov, and you can see all the processes that this bill went through over the course of the session. You can see there was quite a bit of back and forth where it was passed and then put back into committee and then out of committee. In the end, it failed by simply 1 vote in the Senate. It passed the House by 3, and it came down to the Senate telling not to pass at just 1 vote. So we fully expect to see this come back again for the 2023 legislative session. And I can tell you that TFND will be highly focused on educating and advocating around preserving our indoor smoke-free air law again, even more so because we believe a 3rd attempt will probably have their best shot to go through, because there are going to be so many unknown factors with this upcoming legislative session. And so over the next 6 to 8 months, it's going to be crucial to have our advocates and our champions out in communities all across the state talking about the need for this law to be preserved, talking about how we don't want to go back to the days when there was a smoking section and a non-smoking section, because we know smoke doesn't stay on its side of the restaurant. And we know that ventilation systems can't suck all the chemicals out of the air to a point where there aren't any health defects or health impacts. And so we fully expect to see another attempt in 2023 on this particular bill, and having failed only by 1 vote and having all these unknown factors due to elections, to the redistricting process that just occurred with our legislative districts in our state because of the census having come up, and due to many retirements that have hit the news lately. We really think that there's a lot of work to be done at the basic level of just re-educating our legislative body on the policies that provide health benefits to North Dakotans, and our indoor smoke-free air law is definitely one. So continuing on, last legislative session, we also did attempt to have some price increase bills sponsored and put through. They were the tobacco tax bills, 1403 and 1422. These would have substantially increased the price of tobacco products, cigarettes by $1 per pack. And then in the second bill, all other taxes would have been raised proportionately for all other tobacco products. And was attempting to include the electronic products as well. Those failed pretty dismally, and that's kind of par for the course over the last almost 30 years now. North Dakota's 44-cent tobacco tax was put into place at that level back in 1993. And so we're coming up on the 30th anniversary of the last time North Dakota raised its tobacco taxes. I don't know of really any other product over the last 30 years that hasn't gone up simply due to inflation alone, let alone other cost increases and price increases. And so that is still a big focus on what we tend to educate and advocate around. Is raising the price of tobacco. We know it's one of the evidence-based policies that does deter youth initiation and incentivize people to quit using tobacco products. And so the health benefits of a large increase in particular can be rather noticeable rather quickly. Kind of a couple of shining lights rather than all just dismal news is that we did have a hold even budget on the tobacco prevention and control program funding this last go round. 2017 and 2019 saw substantial cuts to that funding. So to have it hold even in 2021, we considered a success. In 2023, it is our intention and our goal to have that be the case again and to actually begin advocating for restored funding or additional funding to be put into that program so that more work can be done. We know that over the last several years, with the rise in electronic product use, with the Surgeon General is calling it an epidemic for our youth with all the ENDS products on the market. And then also, we had before the pandemic and before COVID, we were tracking EVALI or electronic vaping related lung injuries. And now with COVID and how that affects lung health, we know that tobacco prevention is probably more important than ever, just simply because our lungs are under attack in a variety of ways. And then our age 21 bill was our other kind of shining light. In 2019, at the end of the year, President Trump did put into federal law the age increase to 21 for tobacco products. And during the 2021 session, our state legislators ratified that into state law. And so now if the federal law ever were to change, North Dakotans are still protected via state law to have age 21 as the purchase age for tobacco products. So that was a really good thing. A few other bills that we kind of tracked and monitored or participated in were related to political subdivisions. And so we were happy to see Senate Bill 2188 fail simply because it was more of a preemptive language bill where it would have taken some of the local control out of cities and counties that wanted to have local ordinances adopted toward tobacco sales. And that's a key factor in our work because of all of the local success is typically what we build on at the state level to get state policy passed. So for instance, by the time we were able to pass the state indoor smoke-free air law in 2012 via that ballot measure, nearly 70% of North Dakotans were already protected by local ordinances. And so it made the case for taking it statewide that much stronger because you don't want North Dakotans left behind based simply on the fact of they live in community X instead of community Y. And so those home rule laws and that preemptive language is something that we always keep a close eye on because we don't want that to be taken away. 2189 and 2190 were a couple of bills that TFND participated on again. And 2189 in particular was our attempt at classifying those ENDS products as tobacco products. And so we were disappointed to see that one get amended into study language and in fact amended into study language that was kind of industry approved, so to speak. And so when that one ultimately did pass out as a study bill, we were actually okay with not seeing it taken up during the interim. And so that bill kind of died, even though it technically was passed. By the time it was passed, it no longer resembled what we were hoping to accomplish in terms of policy and regulation for the electronic products. 2190 was our attempt at regulating internet sales and having all tobacco sales be required to be over-the-counter or face-to-face sales instead of being kind of the honor system that the internet provides and help prevent youth access to them that way. That failed pretty dismally in the Senate, you can see. And then the final bill that we kind of monitored was a simple language cleanup from our Attorney General's office on their enforcement for some of the mechanisms related to the Master Settlement Agreement. So that's where we were. In summary, we didn't really pass some of our key initiatives. We didn't get new tobacco taxes or increases. We didn't get our ENDS licensing, taxation, or regulation, and we didn't get internet sales restrictions. So we do have a lot more work to do. We did, however, to look at the silver lining of things, get the federal law ratified into state law for age 21. We did hold the line on no cigar bars. That was a huge success in our opinion, because preserving that law and not allowing for exemptions helps protect the health of North Dakotans in ways that we can't otherwise. And we did get funding for our program to continue at a hold even level. So those were great successes. Moving forward, what can we do? educate, educate, educate. As I'm saying, the changing landscape of our legislative body in North Dakota could be quite different. There are a lot of unknown factors. Every 2 years, half of our legislators are up for re-election. This next go around for 2022, it is the odd numbered districts. But because we just had a census year in 2020, they, over this past interim, went through a redistricting process. And so with the redrawing of the district lines, there were a number of legislators that got kind of moved out of their district or that got combined into districts. And so all of those folks will now be up for re-election too, as they kind of figure out who lives where and is within what boundaries. And so there are more legislators up for re-election than would typically be. And then along those same lines, just in the last 2 to 3 months, we've seen a flurry of retirements from actually some pretty high-profile legislators for North Dakota. We saw 3 out of the 4 majority and minority leaders opt to retire, so that the minority leader on the House side, Representative Josh Boucher, is the only one returning. And then we saw a number of other, very long-term allies and opponents alike actually opt to retire or not run for re-election in their districts. And so there's going to be some interesting, I think, food for thought to come up as we work through who might be friendly to our policy initiatives and who might be oppositional. And I think a big ask you'll be seeing from Tobacco Free North Dakota in the coming weeks and months will be to simply help us interact in your communities and for you to do some of that just basic level education with new people as they announce their candidacies, as they win their primaries this summer and go into the general elections, and then ultimately as they're elected or re-elected in the fall of 2022. I think it will be very key for us to have given them some background on why tobacco prevention policy is so important and what it can really provide in terms of state resources. So I actually only have a few minutes left. I see I want to leave a couple of minutes at the end for questions. And so I'll just kind of breeze through these last couple of slides. These are things that we would work hand in hand with you on if you're interested in participating in either local policy efforts. If you're working on ordinances of any kind, TFND can provide resources and support, testimony, any knowledge that we have to help you do that. Or if you want to participate with us at the state level, we can loop you into our coalition work and help give you any support that you would need to be able to come and interact during the legislative session at the Capitol alongside us. These are community-sponsored activisms and activities that we've helped youth do. We have youth summits coming up at the end of March in Bismarck and Fargo. We also, participate in community forums and conferences and educational events that you might be putting on in your communities. We're happy to travel around the state to do such things or to provide you resources or support for you to put on these types of projects and things yourself. Because at the end of the day, it's about building that education and grassroots support that we so desperately need when it comes time to giving political leaders reasons to enact the policies that we're asking them to enact. And using the media to this purpose. If you didn't get a chance to view December's TFND-sponsored educational webinar series, Andrew, our coalition program director, did an excellent webinar on how to interact with the media as a public health person or with a public health focus, if you're not a public health person, but you want that focus. And so you can go back and find the link to that webinar on TFND's website at tfnd.org, but it gives you tons of tips and tricks and processes to follow as you're educating through use of the media and interviews, as well as through social media and how to get key messaging out there. And so we'd be happy to be a resource for you in that realm if you want it as well. And then, of course, writing letters to the editor and other, traditional methods of getting education and information out there. We support the tobacco-free holidays that our national partners typically promote and follow, and we can do local events based on those as well. And then if there are any questions, I know that was a lot of information very fast. I'd be happy to answer any questions. To preemptively tell you, in terms of TFND's official legislative agenda, that is currently being worked on by my board of directors. In fact, we have a board retreat in 2 weeks where we'll be outlining kind of our priorities for the 2023 session. And so we'll have more information to release on that at the end of February and into early March. And then we typically will have any of our resolutions of support or individual support cards ready for dissemination in April and early May. I know those are 2 questions that typically come up often, so those are preemptive answers for you. That being said, I've got 4 minutes left. Neil, if there are any questions in the queue, I would be happy to answer them.
Thank you, Heather. Nothing came through. We had a question regarding the recordings, and we will be sending our links out to those after we get those established. So thank you, Heather. We appreciate your time and your information.
Thank you so much again for having me.
You're welcome. Just a reminder, in the chat is a link to the evaluation link today. And as Kara Backer said, you need to complete this evaluation to get your credits for today. We do close these at a certain point. So if you don't get them done by then, the evaluation done by then, you will miss out on your credits. So please do so as soon as you can. And with that, I want to thank you everyone for joining our annual ENDS Summit. As much as we want to hold this event in person, it has not been the reality for us. We appreciate everyone's patience with us regarding the web format. Please remember to complete the evaluation and include any topics you may want covered in future summits. Thank you very much and take care.